Imagine your gut isn't just, a digestion factory. Imagine it's more like a powerful second brain, one that profoundly influences your mood, your decisions, even your overall health.
It sounds dramatic, but yeah, we're talking about this whole microscopic universe living inside you.
A universe that's constantly chatting with your mind.
Exactly. It's a truly astonishing concept, really. A paradigm shift that asks us to rethink who, or maybe what, we are.
And that's exactly what we're here to unpack today. We're taking a deep dive into this fascinating, sometimes really surprising world of the gut microbiome.
What a huge, unseen community, trillions of microbes looking inside you.
Right. And our mission is to uncover how this invisible ecosystem is so intricately connected to your brain and ultimately your well-being.
We'll explore how the connection works, how modern life affects it.
And crucially, what you can actively do to maybe optimize your own brain-gut health.
It's quite a journey, actually, from a very reductionist, sort of machine-like view of the body to something far more integrated and, well, alive.
For decades, medicine often saw the body like a really complex machine, right? Independent organs.
The mechanistic view.
And if one part broke, you'd fix it or replace it. Simple as that almost.
And that precision-focused approach, it worked incredibly well for acute things, infections, heart attacks, surgical emergencies,
Absolutely. You could target a specific problem with an antibiotic or a new procedure. There was this sort of optimism.
That eventually we'd solve everything that way.
But it really struggled with the rise of chronic conditions, didn't it?
It really did. I remember as a medical student being struck by how little focus there was on the brain's involvement in really common issues. Things like stomach ulcers, hypertension, chronic pain.
Things that didn't always have a clear broken part.
Exactly. So many patients had symptoms with no obvious physical cause. Doctors were often bewildered. I even had one professor, very senior, express skepticism that the brain-body link could ever be scientifically studied.
So the brain was kind of separate, off in its own world.
Pretty much. Its influence was seen as too nebulous, too hard to pin down scientifically. But something definitely shifted.
Right. What was that shift?
Well, over the past, say, 40 to 50 years, we've seen declines in health that the old model just can't fully explain.
Okay.
We're realizing that these complex regulatory mechanisms, deeply impacted by our changing lifestyles, they don't operate in isolation. They work as a whole interconnected system.
And the gut is a major player in that system.
A huge player. The gut, its microbiota, that's the bacteria, archaea, fungi, viruses living there, and their collective genes, the microbiome. It influences almost everything.
Like what?
Oh, how we absorb food, our metabolism, our immune response, and critically, our brain health.
So if the old picture was a machine with parts, what's the new picture? You mentioned this idea of a superorganism. That sounds big.
It is big and revolutionary. The gut microbiota isn't just hanging out, it's this astounding collection. Over 1,000 species, maybe 100 trillion microbes.
100 trillion. That's hard to even grasp.
It is. To put it in perspective, these microbes weigh about as much as your liver, more than your brain or your heart.
Wow.
So this leads us to see humans as superorganisms, a blend, really, of closely interconnected human and microbial components fundamentally dependent on each other.
Okay, that's a major takeaway right there. We're not just human. We are, in a very real way, walking ecosystems. Superorganisms. Our microbes are as fundamental to our health as our own cells. That really does force a rethink, like you said.
Yeah.
Like Copernicus or Darwin.
It does. It demands a kind of biological humility,
Yeah. And this superorganism, it's not silent, is it? It's communicating. Let's start with the brain-to-gut direction. We know our brains control facial expressions for emotion.
Anger, joy, sadness, you see it on someone's face.
But the gut is also kind of an open book for emotion.
Absolutely. For maybe 15% of people in the U.S. suffering from brain-gut disorders, things like IBS, chronic constipation, indigestion, the gut really is, as some say, a theater where the drama of emotion plays out. Yeah. Symptoms like queasiness, that fluttering feeling, even pain, they're often direct physical outputs of emotional reactions. Though, honestly, most patients, and even many doctors, don't always make that connection consciously.
Can you give us an example, something that really shows how dramatic this can be?
Sure. Think about Bill, a 25-year-old guy who suffered excruciating stomach pain and just unstoppable vomiting for 8 years.
8 years?
Yeah. He was often mislabeled, sadly, as drug-seeking because tests couldn't find anything obviously wrong. His mother actually did her own research and found he matched cyclical vomiting syndrome, which is genetically linked to migraines.
Okay.
But here's the telling part. Before an attack, Bill would get about 15 minutes of intense anxiety, sweating, pounding heart, classic stress response stuff, often waking him up early in the morning.
Wow.
It's just such a powerful illustration of how an overactive stress system can trigger these really profound gut reactions.
That's incredible. And this isn't a totally new idea, is it? You mentioned historical examples.
Right, like William Beaumont and Alexis St. Martin back in 1822.
The guy with the hole in his stomach.
That's the one. Beaumont was an army surgeon, St. Martin a fur trapper with this permanent gastric fistula from a gunshot. Beaumont could literally look inside his stomach.
Wild.
And he observed directly that when St. Martin got angry or irritable, his digestion actually slowed down. It was maybe the first scientific observation of emotions physically affecting the stomach.
So our feelings aren't just in our heads. They have real physical effects. How did that work biologically?
Well, researchers like Jake Panksepp identified these core emotional operating programs in our brains, fear, anger, sorrow, etc. They're genetically coded, and they direct automatic bodily responses. Stress is a huge activator here. Chronic stress from daily pressures or even physical things like infections or not enough sleep, it dramatically ramps up our body's stress hormones like cortisol.
Right, the fight or flight system working overtime.
Exactly. But what's really critical is that early life trauma can actually chemically tag these stress response genes. It's called epigenetics.
Tag them like sticky notes.
Kind of. It makes them oversensitive later in life. So you can have two people facing the same stress, but one reacts with a much stronger, maybe gut-focused response because of those early life experiences.
That connects so many dots. Childhood experience influencing adult physical health, it's a lasting imprint.
It really is.
Okay, but what about the other way? How do sensations from the gut become those gut feelings we talk about?
Well, your gut has its own incredibly sophisticated little brain. It's called the enteric nervous system, or ENS. It's embedded right in the gut wall.
A little brain.
Yeah, it can actually operate independently of your main brain. There are videos showing a guinea pig intestine propelling a pellet along all by itself after it's been removed.
No way.
It's amazing. Your digestive system is meticulously processing food, the stomach grinding with acid, the gallbladder and pancreas injecting enzymes, muscle contractions, moving things along just right. It's constantly sending signals upwards.
A whole internal world sending messages.
Yeah.
But for some people, those signals get distorted.
Exactly. Most of us aren't consciously aware of every little gurgle, but for maybe 10% of people, these signals are perceived as corrupted or amplified. Hypersensitive.
Like the example of Frank.
Right. Frank, 75 years old. After his wife died, he developed IBS-like symptoms, that globus sensation, like something stuck in his throat, belching chest discomfort. Tests were normal.
So what was it?
It seemed to be a generalized hypersensitivity to normal gut sensations, likely triggered by the grief, but maybe amplified by his long-term diet high in animal fats and sugar, which we now know can sensitize that gut-brain communication pathway.
Grief and diet together.
Wow.
And you mentioned serotonin earlier. That plays a big role, too.
A massive role. Over 90% of your body's serotonin isn't in your brain. It's stored in your gut.
90% in the gut.
Yep. I had this memorable experience with food poisoning in India, E. coli. The toxins directly bound to my serotonin receptors, and bam! Instant switch to, well, let's just say horrific vomiting and hurricane-like diarrhea. It just shows the raw power of gut sensations when serotonin gets involved. Research also links low serotonin diets to increased brain arousal and gut sensitivity.
Okay, this is where it gets even more mind-bending. It's not just our own cells talking. The microbes get involved. This microbe speak.
This is where things get really revolutionary. We used to think of gut peptides as simple on-off switches for digestion.
Right.
Now we're seeing them as part of a universal biological language used by the gut, the main brain, the little brain in the gut, the immune system, and the microbes themselves.
The microbes use our language.
Maybe it's the other way around. We've found ancient microbial versions of our own gut hormones. Insulin, noradrenaline, endorphins, serotonin. Nope. The implication is that our own signaling molecules might actually have originated in these microbes billions of years ago. Our gut feelings could literally be ancient microbial whispers.
That's profound. Our chemical conversations might be borrowed from bacteria. So can these microbes directly influence our brain, our mood?
The evidence is getting stronger and stronger. Take Lucy, a 66-year-old woman, developed severe panic attacks after a course of broad-spectrum antibiotics for a sinus infection.
The antibiotics wiped out her gut bacteria.
Exactly. Disrupted her gut microbiota. And the panic attacks started right around then. It suggests a direct link.
And animal studies back this up.
They do. Specific probiotics, like certain lactobacillus strains, have been shown to decrease anxiety-like behaviors in mice, and a UCLA study found that women eating probiotic-rich yogurt showed changes in brain regions linked to emotion.
Incredible. So it's not just digestion, it's mood, anxiety.
Yeah.
This leads us right into how early life sets the stage for this whole gut-brain microbiota connection.
It really does. Psychologists like Alice Miller pointed out long ago how adverse childhood experiences often lead to later psychological issues. We see this clinically, too. Take Jennifer, lifelong belly pain, anxiety, depression. Her history included significant maternal stress during pregnancy and her parents divorcing when she was 8. These early life stressors deeply impacted her adult health, including her IBS. Studies suggest maybe up to 60% of IBS patients report a history like that.
60%.
Okay.
And Michael Meany's research with the rats really highlighted the mechanism, didn't it?
Absolutely groundbreaking work. Meany showed that rat pups with nurturing mothers grew up laid back, less stressed. Pups neglected by their mothers became anxious, depressed, more prone to addiction.
And it wasn't just behavior. It was physical brain changes.
Dramatic structural and molecular changes in the brain, altered stress hormone production, less efficient stress response systems, and crucially, this was linked to those epigenetic modifications we talked about.
The chemical tags on DNA.
Yes. Influenced by the mother's care or lack thereof, changing how genes were expressed without changing the underlying code.
So it's environment literally shaping biology through these tags. How do microbes fit into that picture?
McMaster University research took it a step further. They confirmed poor mothering in rats, increased gut stress responsiveness, and anxiety-depression behaviors. But, and this is key, they found these psychological effects were dependent on changes in the gut microbiota.
Dependent on the microbes.
Yes, which implies something really hopeful. Maybe, by modulating the gut microbiota later with diet, prebiotics, probiotics, we could potentially reverse some of those negative effects of early adversity. The microbes aren't just passive, they're part of the programming.
That's huge. A massive takeaway for parents, future parents,
Yeah,
anyone interested in development.
definitely.
And it starts right from birth, that first microbial inoculation. You mentioned witnessing a Yanomami birth.
Yes, it was a powerful experience, very natural, very microbe-rich. It really contrasted with the old Western idea of a sterile womb.
Which isn't accurate anymore, right?
No. Research now shows maternal gut bacteria in umbilical cord blood, amniotic fluid, the placenta. And during a natural vaginal birth, the baby gets coated in the mother's vaginal microbiota, especially beneficial lactobacillus. That forms the foundation for the baby's own gut colonization.
And then comes food. Breast milk specifically seems incredibly important. You mentioned HMOs.
Human milk oligosaccharides, HMOs, they're amazing, complex sugars that human babies can't actually digest themselves.
And why are they there?
They're prebiotics, food for beneficial gut bacteria, especially bifidobacterium species. Breast milk isn't just nutrition, it's like a precisely designed fertilizer for the baby's growing microbial garden.
Wow. Selectively feeding the good guys.
Exactly. It helps create an environment that protects against pathogens and helps program the baby's developing gut microbiota and their brain circuits.
And the long-term benefits are significant.
Very. Longitudinal studies link longer breastfeeding duration to larger infant brains, better cognitive, emotional, and social development. One study showed breastfed 8-month-olds had a greater brain response to happy expressions, possibly linked to oxytocin release during nursing.
That whole early brain-gut microbiota connection sounds absolutely foundational for lifelong health.
It really is.
Okay, so if that's the ideal start, how are our modern diets messing things up? What's the typical North American diet doing to this delicate internal ecosystem?
Well, to be blunt, the standard North American diet is profoundly unnatural.
Unnatural how?
Think about it. Fast food, ultra-processed snacks, huge amounts of animal fat, over 35% of calories for many Americans, plus excessive sugar. It all drives obesity, food addiction, and this chronic low-grade inflammation throughout the body.
Inflammation. How does the diet cause that?
Well, molecules from bacteria like LPS can breach the gut barrier partly because the diet damages it and get into the bloodstream. This triggers inflammation, even affecting brain regions like the hypothalamus, which controls appetite.
So it makes you less sensitive to feeling full.
Exactly. It makes those appetite-regulating centers less responsive to satiety signals, so you overeat. Plus, you develop these really strong conditioned responses or cravings for high-calorie foods. It's a dangerous cycle in our current food environment.
And it's not just what we eat, but how it's produced, right? You contrasted Bavaria with feedlots.
A stark contrast: industrial agriculture, cattle crammed into feedlots, fed corn they didn't evolve to eat, often given antibiotics. And then our main crops, corn, soy, wheat, often grown in monocultures, heavily reliant on fertilizers and pesticides like glyphosate. This devastates the microbial diversity in the soil, harms pollinators like bees.
And harms our own gut microbes, too.
It seems very likely this dual chemical insult, pesticides, antibiotics in the food chain, it's hitting us from multiple angles. Some researchers think it might contribute to rising rates of brain diseases like Parkinson's. It certainly contributes to obesity.
You mentioned Aubrey's constipation.
Yeah, his severe constipation, which we now know can be an early Parkinson's symptom, started decades before his diagnosis. It makes you wonder how much his typical high-fat North American diet interacting with his gut might have played a role in the disease process over time.
That sounds like a perfect storm.
Mm-hmm.
And then we layer on food additives, things like artificial sweeteners.
Ah, yes,
Heck.
the unseen saboteurs. Artificial sweeteners were designed to give sweetness without calories, right? Help with weight loss.
That was the promise.
But studies, especially in mice, show they can actually induce glucose intolerance and metabolic syndrome. And they do it by altering the gut microbiota, encouraging microbes like bacteroids, similar to what happens on a high-fat diet. They can cause inflammatory changes along that gut-brain axis, so they might not help with weight loss and could even cause harm.
Emulsifiers, what are those?
They're detergent-like molecules, things like polysorbates, citric acid esters, added to processed foods to improve texture and consistency, make things smooth. But they can disrupt the protective mucus layer lining your gut, and they can loosen the tight junctions between your gut cells. This basically gives microbes easier access to your immune cells underneath.
Promoting inflammation again.
Yes, what some call metabolic toxemia, not good.
Okay, what about the elephant in the room?
Yeah.
Gluten. Everyone's talking about gluten-free.
Right. Well, first, celiac disease and wheat allergy are definitely real established conditions. Gluten-free diets are essential and effective for people with those.
But for everyone else.
The widespread claims that gluten is harmful for everyone lack strong, consistent scientific backing right now. There's this thing called non-celiac gluten sensitivity, but it's poorly understood. Is it really the gluten? Or is it other components of processed wheat? Or other additives in the foods? Or changes in gut microbes triggered by the modern diet overall? We don't fully know.
So people who feel better off gluten, even without celiac.
They might be, as one researcher put it, the canaries in the coal mine. Their sensitivity might be signaling broader issues with our modern, highly processed food supply, rather than an inherent problem with gluten itself for most people. We need more research, but it definitely points to gut sensitivity being a real issue.
It sounds like we need to step away from the modern processed stuff and maybe look back.
Yeah.
You mentioned the Mediterranean diet as having ancient wisdom.
Absolutely. The Mediterranean diet isn't a fad. It's an eating pattern that's been around for maybe 2,000 years. And there's a remarkable scientific consensus on its benefits.
What defines it broadly?
It's rich in diverse plant foods, lots of vegetables, 5+ servings a day, legumes, 1 to 2, fruits, 3, whole grains, 3 to 5, and healthy plant fats, especially olive oil, around 5 servings, plus seafood a few times a week, and very limited red meat, maybe once a week max.
And the olive oil is key.
Particularly high-quality polyphenol-rich olive oil. Those polyphenols are powerful antioxidants and seem to benefit the microbiome.
And the health benefits are well proven.
Incredibly well documented. Extensive research links it to reduced mortality from all causes, specifically lower rates of metabolic syndrome, heart disease, cancer, cognitive decline, and even depression.
Benefits for the brain, too.
Yes. Studies show older adults sticking closely to a Mediterranean diet have larger brain volumes and better nerve tissue integrity. Lower meat and higher fish consumption seem particularly important factors there.
And how does it impact the microbiome?
The sheer diversity of plant fibers, all those complex carbohydrates, and the high levels of polyphenols act as excellent prebiotics. They feed beneficial gut microbes, promoting diversity and resilience.
But you said it's more than just the food itself.
Definitely. The lifestyle component is huge. Sharing meals, the social connection, the enjoyment of delicious fresh food that contributes significantly too. Happiness and community are powerful ingredients for health.
Okay, this brings us to the really practical part. How do we, listening right now, become the conductor of our own inner symphony? What are the actionable steps for better gut-brain health?
Right. First, let's think about what optimal health even means. It's not just not being sick. It's about high resilience, that ability to bounce back from challenges, physical or emotional. I had a friend, Melvin, who survived a plane crash, serious injuries, but he was back at work 3 weeks later. That's resilience.
Whereas many people are in a kind of pre-disease state.
Exactly. Like
Yeah.
Sandy in the book, chronic stress, low energy, maybe some weight gain, digestive issues. No formal diagnosis, but clear signs of systemic inflammation. We want to help you move away from that state towards true resilience.
So, step one, nurture the microbiome. Think like a farmer.
Precisely. Your microbiome is your inner farm. Your microbes are your livestock. The absolute key is maximizing diversity. That equals resilience.
How do we do that?
Increase your intake of diverse plant fibers. That's the prebiotic food for your microbes. Eat naturally fermented foods, which contain live microbes, things like yogurt, kefir, sauerkraut, kimchi. Eat moderate amounts of lean protein, especially fish and poultry. But know that it's much easier to lose diversity, say, with antibiotics, than it is to significantly increase it once you're an adult. Early life is really the crucial window for establishing high diversity.
Okay, maximize diversity. What else? Reduce inflammation.
Yes. Cut way down on animal fat, especially from conventionally raised animals. Actively avoid mass-produced, ultra-processed foods. Choose organic whenever you can to minimize pesticide exposure.
Read labels.
Definitely. Be aware of artificial sweeteners, emulsifiers, high-fructose corn syrup, added vital gluten. Be mindful of pesticides used on GMO crops and the potential for low-dose antibiotics in mass-produced meat and poultry. These are all potential disruptors to your gut ecosystem.
And for women thinking about pregnancy.
It's so important. Your diet and stress levels during pregnancy and breastfeeding have a profound, lasting impact on your child's gut microbiome development and their brain programming. It really influences their lifelong susceptibility to things like anxiety, depression, and gut diseases. It's a critical period.
We also need to think about how we eat. Mindful eating.
Absolutely essential. Try not to eat when you're stressed, angry, or sad. Those negative emotions directly harm that gut microbrain communication. And they often lead to reaching for unhealthy comfort foods, right? Remember Frankenthal? Conversely, make time to enjoy meals. Share them with others if you can. That happiness, joy, social connection, those are positive ingredients that benefit your gut and your microbes. It echoes that social aspect of the Mediterranean way of life.
And finally, listen to your gut. Trust those feelings.
Yes. Learn to listen. Your gut evolved over millennia dealing with natural, diverse foods. It often struggles with the high fat, sugar, and additives in modern processed foods. Trust its signals hunger, fullness, discomfort over the slick marketing of industrial food products. Remember, your earliest gut feelings form the foundation for much more complex emotional and even moral judgments later on. Some people even find things like dream analysis helpful for accessing that deeper inner wisdom connected to our core bodily feelings.
This has been such an illuminating deep dive, from seeing the body as a machine to understanding ourselves as these complex, communicating superorganisms.
Yeah, where the gut, its incredible microbial community, and the brain are in this constant, really profound conversation.
And seeing how everything from our childhood experiences to our daily food choices directly shapes this critical axis.
Yeah.
It's powerful.
It really shifts your perspective, doesn't it? The body isn't just a machine to be fixed. It's this intricate ecosystem to be nurtured and cared for.
And that's the empowering part. You, the listener, you are the conductor of this inner symphony. Understanding these connections gives you the knowledge and hopefully the motivation to actively participate in your own health journey.
Taking charge.
So, for you listening, here's that final provocative thought to mull over. How might actively farming your gut microbiome, making conscious dietary choices, tending to your emotional well-being, how might that not just prevent disease, but actually unlock a level of optimal health and resilience that maybe evolution always intended for us?